This breast cancer awareness feature is brought to you by Guardian Life of the Caribbean and Pink Hibiscus Breast Health Specialists.
That's right, we're into our Breast Cancer Awareness Month. Now, for the first hour, we'll be talking about breast cancer awareness. And my first guest is Avril Harry, who is an oncology nurse. Good morning, Nurse Harry.
Good morning, and good morning to Trinidad and Tobago.
I'm so happy that you're here. And we're going to be talking about how do you conduct a self-examination. But
Correct.
first of all, for the men, is this something that men would also need to do?
Not necessarily, but generally speaking, when a man showers, for example, his breast tissue is so minimal that if there is something to be felt, he will be able to feel it.
Okay.
But more so, it is geared towards women because of the amount of breast tissue we have and because of the risk associated with breast cancer. So it's recommended that women do breast self-examinations.
And at what age should they start?
It's recommended that women become breast aware at the age of 20.
Okay.
So therefore, breast self-examination should really start by that age, given the fact that women are in their reproductive years and there are certain changes that the breast goes through. So it's recommended that women start at the age of 20.
And how often should you do it?
It's recommended that it's done once a month, particularly 10 days after your cycle.
Okay, why
That's
is
the
that?
best time. It's done, given the fact that the hormone levels at that point in time are normal. So essentially, it's a good time to examine the breast.
And what exactly are you looking for? So, and how do you do it? So I know you worked with some,
The
tell me
model,
what
correct.
you had here, yes.
Okay, so I have a breast model here, and within it there are some lumps which you will be looking for today
okay.
as part of the exercise. And also, this is called a thingamaboob. It's something that's used internationally. A thingamaboob, correct. And essentially what this helps us to show, essentially, is where you can find a lump at breast examination and at mammography. So we'll be going through that in a short bit.
Okay, sure. So
Yeah.
which one are we doing first?
We're going to be doing the model first.
All right. So let me
So
come.
there are three important factors in doing a breast self-examination. TLC, quite easy to remember. So it's about the touch, it's about the look, and it's about checking. Super important. Okay? So in terms of the examination itself, it's recommended, first and foremost, you stand before the mirror. Essentially, you stand with your hands at your side, looking at your breast. So that allows you, correct, to see certain changes.
Right.
And it allows you essentially to, it's very important to keep in mind that the purpose of breast self-examinations is really for a woman to become familiar with her breast.
Right.
By becoming familiar with your breast, if there are any changes, you'll be quite easily able to identify them. So that's the objective here. Okay. So as we look in the breast, you want to pay attention to the skin, the contour of the breast.
Okay.
And with each month as well, if there are any changes, it will be quite easy for you to pick them up. So we're looking for common things that we're looking for example, would be redness. We're looking for dimpling of the skin. We're looking for changes in the nipple as well. Those are some of the key ones that one can look for. But again, going back to the original objective, you're looking for anything that's different to your normal. And the only way you would know what your normal is if you're doing it monthly.
Monthly, right. Okay. So I want to get to actually the actual examination.
Sure,
Yes.
sounds good. All right, so this is going to be our model for today.
Right.
So you want to use the flat part of your hand, and we want to look at the breast like a clock. You want to be able to do the entire...
Are we taking it out?
No, it's going to be used right here.
Oh,
Yeah,
okay. Okay.
within the-
All right. Okay.
Yeah. So essentially, we would want to start from the top of the breast tissue,
Right.
which essentially is this area here. That's a critical part, and all of this encompasses breast tissue. Some women think it's just the area with the nipples and so on, but it's actually a little bit higher than that as well.
Right, okay.
Constitutes the breast tissue. So you want to take the flat part of your hand, and you want to do like a clockwise, whether it's anti-clockwise or clockwise, either one. But the important thing is to ensure that you do in the entire periphery of the breast.
Okay.
So you want to do a light feel, nice circular motions, and then you want to go a little bit deeper. A little bit deeper. And again, by doing this monthly, you will become familiar with the texture of your breast so that if there are differences, you will be able to pick.
Okay.
So I'm going to give you a challenge now, Lisa. So I want you to see if you, yes, it is a bit soft. I want you to see if
So
you're
should I
able.
put it down here?
You can, whichever suits you, because essentially when you're doing this examination,
It's
going to be
pretty much
your
like
breast.
this.
Correct. Correct.
Like that. That's
Yes.
where's my camera there.
That's
Yeah.
correct.
Like that. Yeah. Right?
Yes.
Yeah.
Okay, so I want you to see
Can
if
I
you
do
can.
it here?
Absolutely.
Okay. So you're doing. So
Or
your
you can
hand
do
is
it on
usually
the-
up like this.
Correct.
Right. So you're going around like this.
Yes, in a clockwise motion. So you do a light. That
Oh,
will allow
right.
us a light first.
Yeah.
And that allows us to see if there are any superficial lumps or changes.
Right.
And then you want to go a little bit deeper.
Like that.
Well, I can appreciate this is not your breast tissue, so it's
Yes,
different for
yeah,
you.
yeah, it feels weird. So I'll
Okay.
put it back on the table.
So were you able to discover any lumps?
No,
Lisa?
that's why I want to put it on the table because you said there are lumps in
There
here.
are lumps in
Okay,
there.
so that means I wasn't pressing hard enough.
So you could go a little deeper. And again, it's your breast tissue, so you'll know how deep you can go. And if it's painful, of course, that's something for you to note.
Right.
It's also worthwhile for women.
So
to
you
be-
shouldn't be feeling any pain.
so you shouldn't be feeling any pain. It's worthwhile too if you have like a little diary or a little
There are
log.
lumps in here?
Yeah,
So
there are
this
lumps
is how
in there.
hard you have to
So you have to
press?
go a little bit deeper, but you're using the tips of your fingers, which is not recommended.
Okay,
Yeah.
so I'm supposed to do like that.
Correct.
Okay.
Found anything?
Tell me where it is.
Oh.
And then I'm doing it wrong, I think.
Yeah, so you
Right.
want to use the
You
this
show me
bit
how
of
to
your
do it.
hand,
Mhm.
correct? So you want to use this bit of your hand and you're doing circular motions.
Okay.
So
Let's
if
try.
you were to feel right here, you would feel a lump
Let
right
me
there.
see, let me see. All right.
Felt it?
Yeah. All
you-
right.
but
Okay,
in-
but that meant I had to go very deep.
Correct.
To
So
do
that's
it.
why I said the first one would be light, and then the
Mhm.
second one would be a little bit deeper.
Oh yes,
And-
look.
Yeah.
Oh.
Very good. Good job. So excellent. So that's the point
Wow.
as well. By you
Okay.
getting familiar with the
Yes.
texture of the model,
Yes.
similarly, by you getting familiar with the texture of your breast,
But Nasari, this is something else, because I had to go really deep to find this lump.
but this again, the positioning of your position as well, and
Yeah.
also again by you doing repeatedly, you will be able to discover it.
Okay.
But the important thing is that you're doing it monthly,
Right.
and then thereafter, annual checks. That's
Okay.
super important. So let's use the fingeraboo.
Yeah.
So generally speaking, a woman with breast self-examination is able to identify a lump that is this size, which is roughly about 2 to 3 centimeters.
So the size I felt would have been about which size?
approximately.
This size. Okay.
Correct. Within this model as well, there are lumps that we could not feel.
Mhm.
So that's also important to note.
Yes.
In terms of the clinical team, we are able to feel lumps that are this size, roughly about 2 centimeters and under, and about half centimeter or so, which will be this one.
Right.
However, we are unable to feel this one here.
Right.
And that's the importance of
The
doing
mammogram
the imaging and the
ultrasound.
ultrasound.
Right,
Precisely. So
okay.
you see how it all comes
Yes,
together.
yes.
You have your bits to do,
Right.
and then we have our bits to do.
Okay.
Yes?
Well, Ms. Harry, that brings us to the end of this interview, but it's a lovely segue into our next segment, which is with Dr. Rampol, because then we talk about the actual mammogram,
Correct.
which would identify this little
Correct.
size here.
Correct.
Thank
Even
you
as well as
very
that.
much
You're
for
very
coming on the
welcome. Thank you
program
for
this
having us.
morning.